I'm Dr. Sandy Johnson. I'm a board certified dermatologist at Johnson Dermatology Clinic. And along with me is one of my favorite people, Nina Copeland, who's an advanced practice registered nurse with years of experience of injecting fillers, Botox, and other cosmetic treatments. She actually teaches other people how to inject and how to treat. She's phenomenal. And together, we want to welcome you to our virtual event. And we are so excited about it. We encourage you to stay until the very end. We'll have some questions and answers. You can put your questions in the chat box and we will answer them live. And also, we're gonna have quite a few specials, or exciting things. So everyone that's attending tonight, we are going to put into a drawing to win one syringe of an RHA, either RHA 2, RHA 3, or a RHA 4, depending on what we think you need at your consultation with us. So make sure you stay for that. And then we are also, every single person that is here tonight is allowed to enjoy a special all week long of if you purchase 2 syringes of RHA, you will actually get 1 syringe for free. And so that's a huge value. So at the end of the question and answer, we'll send you guys a text. You just respond with yes, and we can get you set up for a free consultation so that this week at some point you can get 2 syringes, buy 2 syringes, get 1 free. We were so excited to bring the Teoxane group of fillers known as RHA into our practice at Johnson Dermatology a couple of years ago. We offer more than 15 different fillers, but the RHA fillers are a special type of hyaluronic acid filler that incorporates into the tissue unlike any of the other fillers on the market. Because it incorporates so well, it looks very natural. It's very stretchy, so it's able to move with you. It's very dynamic. One of the things they talk about it being a designer dynamic filler, and that is so true, and they do not oversell that. So it really incorporates into the tissue. There's 3 versions that we currently offer. One of them is for more superficial, one is medium, and one is deeper in the skin. And so therefore, we can accomplish so much with these 3 different fillers of the RHA fillers. The RHA fillers last about 18 months. The results, however, are immediate. And as soon as we inject it, you can see the results immediately, which is very beautiful. There's very little downtime. Occasionally, somebody might have a little bit of swelling or a little bit of bruising. Fortunately, at our clinic, we do have a pulse dye laser that we can use immediately afterwards to decrease bruising if that were to occur. Because our injectors at Johnson Dermatology Clinic have years of experience, our rate of swelling and filler bruising or bruising from the fillers or other complications is much lower. Complications can happen to anybody, but we're blessed with our years of experience that our complications are a lot lower. There's really no need for post-care or post-treatment issues after you get injected with RHA fillers. If you wanted to, you can apply some ice. We ask that you don't make a lot of grunting motions because that can increase the pressure in your face and increase your risk of swelling and bruising. But other than that, there really are no complications. RHA fillers give you immediate results. They're hyaluronic acid, which is naturally found in your body. It incorporates great into your skin, and the results last about 18 months. I love the results of RHA filler and encourage you to come in and learn more about them. Okay, so we are using RHA 3, so RHA 2, RHA 3, RHA 4. Kind of think of it kind of like thinnest to kind of thickest or most robust. But we're doing Scarlett's lips. So if you guys look, I've already treated her left. To y'all, it would be her right. So from here
over. She's already been treated. I used a cannula technique, so you can see really not a lot of bleeding, or it's really a no downtime procedure. So what Scarlett was really wanting is, if you can see how this side of her lip kind of turns down over here on her upper lip, she really wanted that turned out more. So you can see I've turned this side out already. I redefined her Cupid's bow a little bit to give her a little bit of height here and poutiness. And then I really pulled out, Scarlett, if you'll just open slightly, I really pulled out this pillow here on her lower lip. I wanted a little more projection here. Her lower lip was sinking in just a little bit. So we put a little here and through here to just really pull out that lip and give her that sexy pout. So now we're gonna do this side. So for those of you that have never had a cannula or have never heard of a cannula, it's kind of like starting an IV. So what we do is we make a little insertion point here of where I'm going to kind of take my filler to, okay? And then I take the needle out, and Alondra here is assisting me, and I just use this cannula like an IV catheter. It's blunt, it's not sharp, so I'm not really hurting Scarlett as much, and she's gonna have a lot less bleeding with this technique. Not everybody is perfect for a cannula, so not everyone's lips do I say, hey, you need a cannula. If you tend to be somebody that swells a lot, then sometimes a cannula is not right for you. If you tend to be somebody that doesn't swell quite as much but really tends to bruise a lot, this cannula is blunt tipped, so it has trouble getting through blood vessels. So theoretically, you should have less bruising with it. So you can kind of see I am seeing right here. See, I wonder if you guys can see that on the video or if it's appreciated. Right there, you can see is where it's white right there. That's the tip of my cannula. So that's where the filler's coming out. I can rotate this cannula around. I don't know if you can see, but there's a little black arrow right there. That's which way the hole is facing. So that's which way I'm putting filler. So if I'm wanting the filler to go back, I can go this way, I can go this way, I can rotate it. And this doesn't really hurt when I'm moving that around to her because the end of this cannula is not sharp. So it's a little bit less painful. It feels to me kind of like somebody scraping underneath the skin instead of sharp. Some people don't like that scraping feeling, so everybody's a little different in terms of I have patients that say, oh, the cannula was so much less painful. And then I have some patients that say, oh, the needle was less painful. So really it just depends on what we're trying to accomplish with your lips and, what is best for you and your past experiences, and your injector too. So right now I'm kind of above her lip, okay? So see right here where she doesn't really have any hollow, whereas where I am right here, there's a little hollow there. This is how we kind of turn up that corner of the lip without even putting anything in the lip. And then I'm gonna just redirect this cannula up into her upper lip. So now you can see I've got it right there. Do you see the tip of my cannula right there? And so what we'll do is we'll just fill her lip and pull out those lateral corners or the sides of her lips to make that a little bit fuller. And then what I'm going to do is, here in just a minute, is go in with the needle. So the nice thing about these RHAs is that they last for 18 months rather than the typical 1 year that a lot of fillers that we put in the lips have. So people just love that longevity. I have some patients that say their lip filler has really never lasted for them, and then they get RHA and they get that 18 months out, and it's like a game changer for somebody like that, because instead of paying for that filler for their lips every 6 months because it wasn't lasting, now they can spend that money in other places. So I've pulled out that there. I'm going to put just a little tiny bit in her corner right here. So you can see I did most of that work from this one insertion site. And now I want to work on her Cupid's bow. And just like I said earlier, not everybody's right for a cannula, not everybody's right for a needle. And when I'm working on the Cupid's bow, I like a needle. It's just a little bit more precise. So I'm going to switch over to a needle now and show you guys that. The natural proportions of the lip are, so the lower lip should show a little more fullness than the upper lip. It's 1 to 1.3, so like this part where you're looking straight on should be bigger. The upper lip should have a little bit more projection though than the lower lip. Most of the fullness of the lips should be in the middle 1/3, and taper off and have less fullness on the sides. So if we just filled her sides right here, didn't put anything right here, we might take away her good proportions, right? The other thing that we think about with the lips is the Cupid's bow. If you fill the lips too much and don't redefine your Cupid's bow, so if I just filled her down here, she would get this kind of flattening effect of the Cupid's bow, which tends to look unnatural. Naturally your lower lip has 2 pillows here and then 3 pillows in the upper lip. So you can see we're keeping her pillow here, here, and here. So right now I'm just going to redefine this side of her Cupid's bow. And with the RHA, what I like to do is just go right below here and just give her a little bit of a definition right there. So see that going up, that Cupid's bow just raising up for her. Just like that. And now she is all done. So you can see that lip filler really can be an easy, no downtime procedure. We just got Scarlett done right in between her seeing patients. So we're just gonna have her ice. We're gonna have her not eat any salt for the next 2 or 3 days. And sleep a little elevated tonight. Other than that, she's all done. Hey you guys, we just wanted to take a minute to thank you so much for attending our virtual event. We know that your schedules are so busy, and Dr. Sandy and I so appreciate you taking time out of your busy schedule to spend with us, educating you about these new fillers we offer at Johnson Dermatology. We hope that this knowledge empowers you to help you be the most skintastic version of yourselves. Whoever won the 1 syringe of RHA, we will be calling you and letting you know that you are the winner. And then we will also be sending text out when the event's completely over. So make sure you check your text and respond with yes if you want to schedule a free consultation so Dr. Sandy and I can customize the plan specifically for you. I invite you now to join Dr. Sandy and I in a question and answer session over the next 10 to 15 minutes. I can't wait to chat with you and answer all your questions. Thanks again.